In 2017, about 340,000 cataract surgeries were performed in Poland. This is the most common procedure in ophthalmic surgery. We can now use two types of procedures when preparing a patient for the surgery to obtain mydriasis, pupil dilation. The classical approach consists of repeated administration of pupil dilating eye drops. As a result, the patient stays at the clinic for 1.5 up to 2 hours before being transferred to the operating room. This is the time required for settling the formalities, changing clothes, and receiving repeated doses of eye drops. In the second, newer procedure, we use mydriatics intraoperatively. We administer these drugs during surgery together with anesthesia. Mydriasis is obtained within half a minute after drug administration, and it is usually sufficient to effectively carry out the surgery. One of the advantages of this approach is that the patient can be operated on only 50 minutes after reporting to the clinic. An English study involving 120 patients published in September 2017 in the British Journal of Ophthalmology showed a similar duration of the patient's stay at the clinic using the classical approach. However, with the use of the new method, much better results were achieved in Poland. This patient underwent cataract surgery first in one eye and then in the other. He received mydriatics twice during the surgery. The total duration of his stay at the clinic, including post-operative assessment, was 2 hours and 50 minutes. If we compare this result with a female patient in whom the classic pupil dilation method was used, the timing was as follows. The reduction of the length of the patient's stay at the clinic is not the only benefit. The application of the newer procedure allows to reduce the doses of mydriatics and ensures a lower systemic absorption of the drug, which directly translates into minimizing adverse effects such as hypertension, fainting, arrhythmia, or myocardial infarction, which may occur when using the conventional eye drops. It should also be mentioned that the new procedure reduces the workload of the support staff who can be assigned to other tasks. This reduces the global cost of a patient preparation for a surgery.
My goal in cataract surgery is not only to provide the patient with the state-of-the-art treatment, but also to ensure that he does not have to spend more than 3 hours at the clinic. This is experience deriving from the research on the quality of life. The intraoperative use of mydriatics allows to achieve this goal. At the same time, this modification of the surgical procedure improves the organization of the patient's flow at the clinic. However, it requires the surgeon to change his habits.
According to the audit of the Royal College of Ophthalmologists of 2017, based on 120,000 surgeries, the quality of cataract surgery is determined, among other factors, by the rate of intraoperative complications in the form of posterior capsule rupture, which may not exceed 2% of the performed procedures. This index, calculated for 689 patients who received intraoperative mydriatics operated by Professor Marek Rękas over a period of 6 months in 2017, was 1.1%.